Hi class, welcome to chapter 18, Diet and Health. This is our last chapter. Yay. So briefly, we're going to look into a few chronic diseases as well as infectious diseases and their relationship with health and diet. So let's get started. First, we're going to take a mini look at our immune system. And our immune system is our body's natural defense mechanism, and it can help protect us against foreign materials, such as bacteria, viruses, pathogens, etc., that we may be exposed to during the day. We have many different organs that play a role in the immune system. And one of the biggest ones is our skin. Another very important organ that plays a role in the immune system is our gastrointestinal tract. And we're learning more and more about the role of the gastrointestinal tract in immunity every day, especially with regards to the microbiome. Nutrition can't necessarily prevent infectious diseases or cure infectious diseases, but adequate nutrition and good nutrition can provide our body the building blocks it needs to mount an immune response and create antibodies, immune cells, etc., to fight off these types of toxins or bacteria that we're exposed to and protect our body. So I mentioned some of the organs of the immune system. Other organs include the mucous membranes, the spleen, the lymph nodes, the thymus gland, and then we have many cells that play a role with our immune system as well. Phagocytes are cells that generally engulf bacteria or foreign substances and then destroy them. They include the neutrophils and the macrophages, and they kind of scavenge throughout the body to look for these issues to arise. And then lymphocytes, we have B cells and T cells, and B cells produce the antibodies and T cells travel to the invasion site. T cells are the target of the HIV virus, and with HIV, human immunodeficiency syndrome or chemoimmunodeficiency virus, the T cells are destroyed. So the virus actually causes the T cells to destroy themselves, and so they don't fight off the virus, and people develop the disease. Nutrient role in immune function. So there are many nutrients that play a role in immune function. And like I said, without these nutrients, we would not be able to create the immune cells, the B cells, the T cells, the lymphocytes, the phagocytes, the neutrophils, and we wouldn't be able to regenerate tissues in some of the organs that play a big role in immunity. For example, the mucous membranes and the gastrointestinal tract, we're constantly regenerating those cells and tissues, so we need the building blocks to be able to do that. Some of the specific roles that are played by each nutrient can be seen here, and with a lack of any one of these nutrients, we can have suboptimal immune response. Nutrition and immunity, or lack of nutrition, is kind of a downward spiral that contribute to poor immunity. So in circumstances of malnutrition, people are more likely to get sick. If people are sick, they're less likely to eat because they feel sick. If they're not eating, they're more likely to become even more malnourished, and if they're even more malnourished, their immune system is not going to recover or be able to form all the cells as well as the tissues that it needs to actively fight off that infection, which is going to make that infection worse and cause their nutritional status to further deteriorate. So nutrition plays a big role in many diseases, and having suboptimal nutrition can make some diseases which wouldn't normally be fatal turn fatal because the body doesn't have the building blocks to fight off those diseases. So even sometimes things like diarrheas can become fatal without the right building blocks for the immune system. Pneumonia, HIV/AIDS, which is obviously potentially fatal anyways, malaria, tuberculosis, the common cold, the common flu, anything that a person can become infected with could be more serious, could take longer to recover from, and could have much more far-reaching effects if that person is malnourished. HIV and AIDS. So HIV is HIV is a global problem, as you can see from this map. That being said, in almost all areas of the globe, the rates of HIV infections are decreasing, which is phenomenal. So you can see each area in the world and how the rates have been decreasing. The only exception is Eastern Europe and Central Asia, and rates have been substantially increasing there. But everywhere else, rates have been decreasing. Even though rates have been decreasing, there are still 1.8 million people infected newly each year, which is a lot of people who are infected each year. The types of medications that they have to control HIV from developing into full-blown AIDS are actually really effective if people have access to them. So it's actually possible for people to have HIV but have their viral load be so low that it's even indetectable with use of antiretroviral drugs that have now been developed. That being said, those drugs are not available to everybody, and so often this isn't the case. HIV and AIDS and nutrition are very interrelated because adequate nutrition can help you live longer, healthier life without other co-infections if you do have HIV or AIDS, where poor nutrition makes you more susceptible to get other infections in addition to HIV or AIDS. And generally with HIV or AIDS, what happens is since those T cells are destroyed, people are more susceptible to developing other infections that wouldn't necessarily be deadly, but they are because of their reduction in T cell production. So even something like the flu or pneumonia or common cold could be very devastating for somebody with HIV/AIDS. And if you combine that in presence of malnutrition, it could be life-threatening. Nutrition support for AIDS is like in any disease and individual plan. You do need adequate protein, calories, and zinc to provide your body the building blocks to form those immune factors. It is very common for people to have poor appetite with HIV/AIDS as well as significant weight loss. And so you would monitor that and try to get these people to eat enough calories, provide very nutrient-dense meals, high calorie, high essential fatty acid, high vitamin, high mineral load. And supplements are kind of interesting. So the HIV virus actually does very well in the presence of iron supplements. And so even though we do see iron deficiency anemia relatively commonly in HIV/AIDS, we're very cautious about how much iron we prescribe in the supplement form because this can actually cause the virus to proliferate or increase in its numbers. Other things that we're concerned about with HIV/AIDS or really any infection where you have a reduction in immunity is risk of food poisoning. And so it's important that people with HIV/AIDS or anybody who has a reduced immune system limit exposure to foods that are undercooked, make sure that their foods are cooked to appropriate temperatures, make sure that their foods are stored appropriately, either at hot temperatures or with refrigeration or freezing. And in some cases, it would even be recommended that these people reduce their exposure to raw fruits and vegetables, especially ones without peels where the peel can't be removed, or unpasteurized milk, unpasteurized cheeses, etc. So you would want to be really careful with foodborne illness because just getting, a normal stomach bug for somebody with HIV/AIDS could be a lot more serious than multiple trips to the bathroom because of foodborne illness. So, what are some leading causes of death in the United States? HIV is not one of the leading causes of death in the United States, although in some areas in developing countries, it is one of the leading causes of death. We tend to have more non communicable diseases and more chronic diseases in the United States. Some of the leading causes of death are heart disease. So, I'm going to very briefly draw these out. So heart disease, that is the number one cause of death. The number two cause of death is cancer. And I just looked up these statistics on the World Health Organization as well as the CDC. Chronic lung disease. So lung disease. Number four is accidents. Number five is stroke. And some surveys will actually clump stroke in the same category as heart disease because it is a vascular disease. Number six is Alzheimer's disease. So I'm just going to do that. Number seven is flu. Or sorry, number seven is not flu. Number seven is diabetes, which I abbreviate DM. And number eight is flu, pneumonia. I'm running out of room here. And then after that is kidney disease. So let's put kidneys because I like kidneys. This is where I work, is with patients with kidney disease. So that was number 9, and number 10 is suicide. Which of these are diet related? I would say heart disease. I would say some cancers. Not really lung disease. Not really accidents. Definitely stroke. We're learning more and more about Alzheimer's. Absolutely diabetes. Probably not flu. And kidney disease is a yes. Some people will not put kidney disease or Alzheimer's in this category, but I don't feel that they know a lot about nutrition if they don't put kidney disease or Alzheimer's in this category. That doesn't mean that nutrition is the only cause of these diseases. It just means that nutrition is a contributing cause of these diseases. What types of foods and diet increase the risk of developing chronic diseases? Hopefully you have learned that in this class already. But diets that are high in processed foods, diets that are low in fruits and vegetables, diets that are high in added sugars. Oops, let's go back. Diets that are high in added sugars, like you can see here. So this is looking at cancer, hypertension, which is high blood pressure, diabetes, atherosclerosis, which is clogging and thickening of the arteries, obesity, and stroke. Hypertension, atherosclerosis are going to be main causes of heart disease. Obesity can contribute to heart disease, etc. So diets high in sugar, diets high in salty or pickled foods. Not all diets high in pickled foods do contribute to disease because pickled foods often are fermented foods, which we're learning about more and more health benefits of. Diets high in saturated or trans fats. Definitely trans fats, especially from processed food sources. Saturated fats, we're learning more about the relationship of these. If saturated fats are consumed in addition to sugars, absolutely. If they're consumed more from whole foods, the relationship seems to be a lot weaker. In fact, some recent meta-analysis have found that saturated fat consumption was not associated with heart disease. So we're learning more and more about that relationship every day. Definitely diets that are low in fruits, vegetables, diets that are low in vitamins or minerals, excessive alcohol intake. These are all contributing dietary factors. And then you can see some environmental as well as lifestyle factors listed below. So age is an increasing risk for all of these. I would argue that age increases your risk of obesity up until about age 65, and then sometimes you do see a drop in overall body weight, but not for all groups. So I would say obesity is a risk for any of these. Environmental contaminants, only with cancer. Genetics plays a role in everything. Sedentary lifestyle plays a role in everything. Smoking and tobacco plays a role in both. And stress, I would argue that stress plays a role in everything. But again, this is an older chart, and we're learning more and more about these relationships every day. So cardiovascular disease is our #1 cause of death in the United States, and cardiovascular disease does include the heart and the blood vessels. So like I was saying before, some people will consider stroke, which is where there's an occlusion of the blood vessel leading to the brain, as a cardiovascular disease because it has to do with the blood vessels. Coronary heart disease, or CHD, is the most common form of cardiovascular disease, and it's specifically affecting the coronary vessels, or the vessels that supply the blood supply to the heart. If these particular vessels have a blockage or a clog in them, then we can't get oxygen to the heart muscle itself, and part of the heart can die. Part of the muscle will not receive oxygen, and part of the heart muscle can die, which, if the heart muscle dies, it can't effectively pump blood to the body. So that's a big problem. Things that contribute to cardiovascular disease are atherosclerosis, which is a hardening and thickening of the arteries, which you can see in this picture here, in this expanded blow-up picture. And atherosclerosis has many contributing factors and causes. It can definitely be diet-related. It can be inflammation-related. It can be due to potentially some genetic conditions. It can be exacerbated by high blood pressure, etc. Currently, the latest statistics for mortality from heart disease were 600,000 people in 2016, where stroke was 140,000 people. So quite a lot of people dying from heart disease. It is the #1 killer in the US. Atherosclerosis blown up. So our normal arteries are very flexible, bendable, elastic. They can expand, they can contract with the flow of the blood. And I like to describe them as like a red vine licorice or red rope licorice, because they're very bendable like that. You can bite the top and the bottom off of a red vine licorice and use it as a straw. Maybe you've done that before as a kid. I have. Anyways, as the arteries become clogged, or as these plaques build up, they become very stiff. And instead of being nice and flexible like a red vine licorice, they are hard like a PVC pipe, or hard like the shell of an egg. If you were to squeeze the shell of an egg, it would crack and break, which is not very good. An egg can't expand or contract. So that's a big problem. What can cause this hardening of the arteries? Many things. So if you have a high LDL cholesterol level, and that LDL cholesterol is not taken up by all the cells, meaning there's an excess of LDL cholesterol versus what the cells actually need. Remember, when your lipoprotein is in circulation delivering the cholesterol to the cells, some of that LDL can end up circulating in the vessels, and if it's not scavenged by HDL to return it to the liver, it can deposit on the artery walls. That can lead to fat accumulation, and then if there's any inflammation or infection, if there's calcium imbalance, if there's cholesterol imbalance, this can further accumulate, and things called fatty streaks will develop. These can thicken the artery walls and narrow the diameter from which the blood can flow through. And this makes it more likely for your blood to clot or get stuck inside one of these arteries. If it's really, really narrow and you're trying to have a lot of blood particles move through it, it can have a traffic jam, and it can actually block blood flow, and that can cause a heart attack or a stroke or reduced blood supply to certain areas of the body. Smoking makes this worse because smoking is pro-inflammatory, and in response to inflammation, you have different inflammatory cytokines, inflammatory cells that will actually move to these areas within the vessels and further increase the plaque formation. They can even form blood clots, and that can further increase the chances that the blood will have reduced circulation. Risk factors for coronary heart disease. Age is a risk factor for all of these. Like I said, in my opinion, obesity too. Male gender, this is a little complicated. Both males and females do suffer from cardiovascular disease. Females are actually more likely to die from a heart attack than males are. Most of this has to do with symptoms in females being different, as well as treatment in females being different, as well as males more likely to actually seek help and have follow-up care after a heart attack. So females are affected by heart disease just as equally as males are. So this has kind of changed a little bit. You can look up Go Red. This is a campaign to raise awareness about women's risk for heart disease. Family history of heart disease raises your risks and is not modifiable. And then things that are modifiable, high LDL cholesterol levels are associated with increased risk of heart disease. So if you go to your doctor and you have your blood work done and it indicates you have high LDL levels, they would recommend some dietary as well as lifestyle interventions to help reduce those levels. Contrary to that, low HDL increases risk because remember, the HDL is the scavenging type molecule that goes and returns LDL to the liver for recycling. High blood pressure, if the pressure is higher and you do have narrowing of these arteries, the chances of there being a blockage are much higher. Diabetes, because it's an inflammatory disease, the blood vessels can become blocked more easily, as well as circulation to the blood vessels themselves diminishes. Obesity, especially abdominal obesity and cells that when you have fat cells concentrated in the abdomen, they actually release different hormones that are pro-inflammatory hormones, and those can contribute to atherosclerosis. Physical inactivity, so sedentary lifestyle, can absolutely contribute. People who are more physically active have lower rates of heart attack, stroke. They also have lower rates of high blood pressure, and physical activity can favorably affect all of the cardiovascular disease risk factors. Cigarette smoking, like I said, because it is pro-inflammatory. Also, it causes the heart to work harder, and it can be associated with higher blood pressure. And then a diet that's atherogenic. So I already mentioned we're learning more about the relationships with saturated fat, and we may be learning that the relationship with saturated fat and heart disease is not as strong as we once thought. I'm kind of in that camp. Older evidence does say there's a strong relationship between heart disease and saturated fat, but some of the newer work is saying maybe it's more sugar related, especially processed refined sugars. Either way, we know that diets that are low in fruits, vegetables, and whole grains are atherogenic and don't contribute positively to heart disease protection. Standards. So if you go to the doctor, what will they look at to determine if you are at risk or maybe already have a potential heart disease? They'll look at total blood cholesterol. They'll look at specifically LDL and HDL. They'll look at triglycerides. These should be taken fasting, meaning you shouldn't have had anything to eat from the dinner before you take your lab exam until after it's done, so at least a 12-hour fast. They'll look at body mass index. With increasing BMI, there's higher risk of heart disease. And then they'll look at blood pressure. But I will make one note that these blood pressure levels have actually changed recently. So 120 to 139 is actually considered high now, as well as 80 to 89 is also considered high. And definitely over 140, over 90 is also considered high. So I have those coming up on the next page, but those have changed. So what specifically is high blood pressure? High blood pressure, otherwise known as hypertension, is just what it sounds like. It's when there is high pressure within your vessels. And it can be measured as systolic over diastolic, which has to do with the force of the heart as it contracts versus the pressure as the heart is relaxing. And there are certain risk factors that increase your chances of having high blood pressure. Some of them I've mentioned already. You can read them there. There are also certain interventions that you can do to limit your chances of having high blood pressure. Weight control, physical activity, alcohol in moderation. If you don't drink, it is not recommended that you start. DASH diet, we'll look at the DASH diet coming up, and then many people will actually end up having to take a medication for their high blood pressure, and most people who take one medication will actually end up having to take two. Blood pressure is a pretty fragile thing to regulate by medication, and doctors often have to try multiple therapies before they can get it perfect. I will say, I'll say that coming up. Okay, so these are the new blood pressure categories, and you can see they're slightly different and much stricter than was on that previous chart. These were recently changed as of November 2017. So you may not have had high blood pressure before, but under the new standards, more people will fall into this category of having high blood pressure. You can buy a home blood pressure monitor for $20 to $30 anywhere online or at the grocery store, Rite Aid, Walgreens, etc. You can obviously have your blood pressure measured in your doctor's office, which they will do when you go, or sometimes you can go to the drugstores and they have blood pressure cuffs where you can sit at a little booth and it will measure for you. So I do recommend everybody have their blood pressure drawn frequently, at the very least maybe every 3 months, just to check on it, because you don't always feel high blood pressure. Some people will, but many people won't notice that their blood pressure is high, and high blood pressure does increase your risk of these diseases, as well as it can increase your risk of kidney disease, which when it's due to high blood pressure is irreversible. So what kind of diets might help our risk of reducing heart disease? Hopefully you can look at this picture and think of healthy fruits and veggies, lots of colors. Don't see a ton of animal products in this picture. Again, the data on that is still a little bit evolving. We've learned some new things recently. Some strategies. So obviously balancing intake and expenditure, not consuming more calories than you're burning so that you can keep a healthy weight. Limiting saturated fat, trans fat, and cholesterol. Again, these are the recommendations of the government. These are also the recommendations of the American Heart Association. These are current recommendations. I will say current research, current evidence is kind of questioning these recommendations somewhat, so stay tuned for changes with this. As far as cholesterol goes, we used to have a limitation on how much cholesterol you should eat daily, but finally they decided that there is not a strong relationship between dietary cholesterol intake and risk of heart disease, and so they actually removed that limit from the dietary guidelines for Americans. Choosing fruits and veggies is always going to be healthy, especially if they contain soluble fiber. Soluble fiber is going to help bind cholesterol, so you're going to excrete more cholesterol, and you're going to have to use more cholesterol in your body to replenish bile, etc. So soluble fiber will bind bile. High potassium, we don't get enough potassium, and so potassium is actually coming out on the food label so that we can better monitor our potassium intakes. Potassium comes from fruits, veggies, nuts, legumes, seeds. It does come from some dairy. It does come from some animal products. And potassium kind of does the opposite from sodium as far as blood pressure regulation. So it counteracts the effects of sodium on blood pressure. An interesting note about sodium, not every person is sodium sensitive, meaning not everybody will respond to high sodium intake by having a spike in blood pressure. it's about 25 to 30% of the population who will. And for those people, limiting sodium can definitely help with high blood pressure. But for people who aren't sodium sensitive, it may not be very effective at all. Minimizing added sugars is an absolute. We know there is zero benefit to added sugars whatsoever. Choosing omega-3 rich foods, we have a big imbalance between our overconsumption of omega-6s, which tend to have more of a pro-inflammatory role, and an underconsumption of omega-3s, which tend to have more of an anti-inflammatory role. Choosing plant sterols and stanols, again, these can help lower cholesterol that's circulating. Consuming soy to replace animal and dairy. There is an FDA-approved health claim with regards to soy and cardiovascular health, which is why this statement is here. That being said, I think there are many other non-soy products, non-animal products as well that could be alternatives. So maybe you could put legumes here, maybe you could put nuts here, maybe you could put beans here. There's a lot of other alternatives to soy if you don't like soy. If you do like soy, great. I like soy. I think it's very versatile, but many people don't want to consume soy for different reasons. Limiting alcohol, physical activity, and smoking. Some diets that will help reduce blood pressure and specifically how much they may reduce them. So by losing weight, by losing just 5 to 10% of your body weight, you can reduce your blood pressure 5 to 20 points, which is, of these things listed here, the most significant intervention to reduce blood pressure. And if you're able to reduce your blood pressure 5 to 20 points, you would probably be able to go off of blood pressure medications or reduce your dose of blood pressure medications if you are on them, or reduce your need for blood pressure medications in the first place. DASH diets, this is dietary attempts to stop hypertension, and we're going to see this diet pattern coming up. It is a diet that has a low sodium plan as well as incorporation of legumes, nuts, seeds, beans, etc. Sodium restriction. For the percentage of the population that is salt sensitive, this may reduce blood pressure. You can see there's a pretty big range here. So for some people, it may only reduce it 2%, or not 2%, 2 milligrams of mercury, which is how blood pressure is measured. Physical activity is beneficial, and it will not only help with your blood pressure, but so many other aspects of health. And then moderate alcohol consumption. So the DASH diet, in this chart, it compares the DASH diet kind of in the center to the USDA food pattern on the far right. And the main differences between the DASH diet and the USDA food pattern are nuts, seeds, and legumes as far as kind of food groups go. And then what's not on this chart is sodium. But the DASH diet was tested at multiple levels of sodium intake, and those who followed the DASH diet with the lowest sodium intake had the highest reduction in blood pressure. Why nuts, seeds, and legumes aren't just part of the USDA food pattern, I don't know. I think everybody could benefit from consuming more nuts, seeds, and legumes. But that's just me on my soapbox. Nuts, seeds, and legumes are great sources of fiber. They're also great sources of potassium, which I just explained kind of counteracts the effects of sodium on blood pressure. So our next chronic disease, diabetes. Diabetes is one of the top 10 causes of death in the United States, as well as worldwide, and rates of diabetes are growing exponentially. This world map is looking at prevalence in 2015, which is the most recent data I could find, with projected prevalence into 2040. And so you can see in North America and the Caribbean, we have 44.3 million people living with diabetes. This is expected to grow to 60.5 million people living with diabetes. In 2015, there were 1.6 million deaths attributed to diabetes. There were another 2.2 million deaths attributed to high blood sugar. And it's expected that diabetes may be one of the higher causes of deaths in 2030 and move up from its spot as number 7, where it is currently. So diabetes is a huge deal. In 1980s, we had about 5% of the population with diabetes. 2014, 8.5% of the population with diabetes. So very, very, very big deal. There are two main types of diabetes. There are not two types in general, though. There are actually more than two types, but most people will suffer from one of these two types, and so that's why we talk about these in an introduction to nutrition class. If you take further nutrition classes, you can learn about different types. This is a very kind of broad table, and this table doesn't really work unless you read the disclaimer at the bottom. So type 1 diabetes is autoimmune in nature. And what happens in type 1 diabetes is there are beta cells in the pancreas and they produce insulin, and the body attacks its own beta cells so that the beta cells are not able to produce insulin. Without insulin, type 1 diabetics are unable to get glucose into their cells. Their cells, in essence, are starving, and since the glucose can't get into the cells, the glucose builds up to very, very high levels in their blood. They'll start to break down fat for energy. They may start to use ketones for energy, but eventually they won't be able to compensate for this, and they'll likely end up in the hospital with diabetic ketoacidosis, potentially acid-base imbalance, breathing, respiratory problems, and they'll need insulin. So people with type 1 diabetes, because their beta cells are destroyed, they do need to take insulin injections. This used to be called juvenile onset diabetes because it was seen primarily in youth, and it does continue to be primarily diagnosed in youth. However, it can be diagnosed at any age, and I have heard of cases of 80-year-olds actually being diagnosed with type 1 diabetes, which is very rare, but it is possible. Type 2 diabetes is not autoimmune in nature, and it accounts for many more cases than type 1 diabetes. Type 2 diabetes is primarily associated with obesity, sedentary lifestyle, metabolic syndrome, family history, and is a disease of insulin resistance, meaning the pancreas is producing insulin, at least with initial diagnosis of type 2 diabetes, but the insulin isn't really working with the cells to allow glucose to get in. And so what the pancreas tends to do is it tries to produce more and more insulin, and it does this, which may help the glucose get into the cells, but eventually the cells become insulin resistant completely, and the pancreas gets worn out so that it can't produce as much insulin as it needs. Many people with type 2 diabetes are able to control this with diet and lifestyle. However, many people also need medication. Medications usually start with oral medication that can work in many different ways to reduce glucose production, to increase insulin production, etc. A common medication given is called metformin. However, many type 2 diabetics who are unable to be controlled with diet, lifestyle, or oral medication may have to use insulin, especially as their disease progresses. And type 2 diabetes, if you see the disclaimer down here, was generally considered adult onset diabetes. However, now we're seeing this appear in younger and younger populations, and it's really quite devastating because type 2 diabetes is considered a preventable disease where we cannot prevent type 1 diabetes. How are we going to diagnose diabetes? So we're going to look at fasting blood glucose and hemoglobin A1C. It is possible to also diagnose diabetes with a non-fasting or random blood glucose over 200. That would be a big red flag for diabetes. So a normal fasting blood glucose would be 70 to 99, and this means normal before you have eaten any food in the morning. A normal hemoglobin A1C would be less than 5.7. What is hemoglobin A1C? Hemoglobin is a molecule within our red blood cells, and hemoglobin A1C looks at the number of hemoglobins in our red blood cells that have a glucose attached to them, so the number of glycosylated hemoglobins. And when you have a lot of hemoglobin with glucose attached to them, it indicates that over time there have been high levels of circulating glucose, and those high levels of circulating glucose had to go somewhere, so they attached themselves to the hemoglobin molecule. Those hemoglobin molecules with glucose attached to them don't function quite as well as hemoglobin molecules without glucose attached to them. And really what this indicates is that glucose is also attaching to potentially every other cell in the body. So hemoglobin happens to be an easy measure, but the glucose can actually be attaching to every other cell in the body. And when it does this, it has the potential to change protein structure, change cell function, etc., and cause some cellular damage. So we look at the A1C to indicate the average blood sugar over the last 3 months. In prediabetes, fasting blood sugar is a little higher, between 100 and 125. And for a diagnosis of diabetes, we see a fasting blood sugar of 126 or higher. So this could be tested with a simple blood draw in a laboratory. Many people don't feel high blood sugar, and some people don't even feel low blood sugar. So it's very, very possible for people to have diabetes and not know it. And in fact, I would say this is mostly what I see in clinical practice. We rarely have a patient come to an office and say, I think I feel like I'm diabetic, then have their blood tested and be diagnosed. Usually we're testing for other things, or they come in with other symptoms and we find out that they are diabetic, kind of as a side test. Complications of diabetes. So complications of diabetes are cumulative, serious, life-threatening. Many of them are irreversible. This is a big deal. It is very important for people with diabetes to do their best to control their blood sugars, work with doctors to get their medication right, work with dietitians to help with diet, work with certified diabetes educators to help with blood glucose monitoring, medication management, etc., and get good support from family and friends. Diabetes can affect every single vessel in the body. It can affect the large blood vessels and contribute to that hardening, inflammation, thickening of the arteries, which can cause heart disease, and it can affect the small vessels. So specifically with the small vessels, we see diabetes affecting the kidneys, the nephrons in the kidneys, which are their functioning units, or the glomerulus in the kidneys, which can lead to kidney failure that is irreversible if it's caused by diabetes. We also see the blood vessels affected in the eye. So we see blindness that can be due to diabetes. We see that blood vessels are affected in the peripheral tissues, so the feet, the hands, etc. There can be diabetic nerve damage. So eventually, since the blood vessels are affected, you'll have a loss of blood supply to the nerves. When the nerves aren't getting adequate blood supply, the nerves will die out themselves. If you don't have nerves, you can't feel anything. And so something that commonly happens is somebody might step on something, get a blister, get an ingrown toenail, not know they have that because they don't have nerve sensation. Then that wound will get worse. It won't heal because there's no blood flow, and diabetes can lead to significant amputations. I've seen patients who have had multiple limbs. It generally tends to be the legs amputated. I have not seen yet an arm or hand amputated due to diabetes. It generally tends to be the feet and the legs, the toes, due to loss of circulation, loss of nerve feeling, getting wounds not healing. So lots of serious complications for diabetes. However, diet can play a really big role in keeping blood sugars kind of as normal as possible. And the closer the blood sugars are to normal, the lower chance of these symptoms developing, or they will develop a lot less rapidly. So they'll develop maybe after 50 years instead of after 20 years. Treatment, like for any disease, is individualized. No diabetic is going to be exactly the same as another. We want to try to get the blood glucose as close to normal as possible. So we'd like it in normal range, and we do have specific ranges for diabetics. Carbohydrate intake is important because carbs are going to be one of the main reasons that blood sugar goes up. In fact, it's pretty much one of the only reasons that blood sugar goes up. It is possible for us to convert proteins and fats to glucose if we need, but carbs are going to raise blood sugar higher than any other nutrient. By consuming the same amount of carbohydrates kind of consistently at meals, it's easier to dose medications so that insulin or an oral medication can be provided to control these raises in blood sugar, these spikes in blood sugar. Since diabetes is a cardiovascular disease, we want to monitor lipids closely because high circulating lipids can further contribute to cardiovascular disease. Physical activity is important because physical activity will naturally raise insulin levels, and insulin can help lower blood sugar. Physical activity for type 1 is going to be slightly different than physical activity for type 2. So that's one of the reasons it will be individual. And then weight control is both important for type 1 and type 2. Type 2 tend to have more concern with overweight than type 1, but everybody is individual. So we can work with patients to maintain healthy weight range for them and their body type, as well as their diet and treatment. Cancer. So number 2 cause of death in the United States. Cancer has to do when cells mutate, and these mutated cells tend to be able to proliferate or grow at a much more rapid rate than other neighboring cells. The mutated cells grow rapidly, but they don't have normal cell function. So maybe you have a kidney cell that has turned into a mutated cell. That mutated cell won't filter the blood like the kidney cell will, but it will continue to grow and grow and grow and use up the energy and maybe even cause some structural damage to the kidney because of its growth. As cells grow, they can cause visible tumors or tumors that can be detected on ultrasound, CAT scan, MRI, etc. Sometimes we can see them that way. Sometimes cells from these tumors can break off and can what we call metastasize into the bloodstream. And if the cells from the tumor make it into the bloodstream, they can go into circulation and they can kind of develop in other organs as well, and the cancer can spread. So cancers tend to be named for the organ where they're first developed in, and then it's possible that cancers can spread to other organs in the body. There are many diet, lifestyle, genetic, environmental factors that have to do with cancer, and we're learning more and more about it every day. Reducing cancer risk. So we do see that certain animal foods do have higher rates of or higher risk for certain cancers, specifically colon cancer, maybe learning a little bit about prostate cancer. We do see that processed foods with a lot of additives, do have higher associations with different cancers. We do see alcohol as having a relationship with multiple different cancers. We definitely see tobacco or smoking as having a relationship with cancers. As far as different diets go, we're still learning more about diet and cancer. They have done some preliminary studies on ketogenic type diets or even fasting type diets in addition to chemotherapy, and they find that people who follow a ketogenic diet or actually do fasts in addition to chemotherapy have more effective chemotherapy treatments and have lower symptoms, lower risks from the chemotherapy, so lower side effects, lower nausea, vomiting, etc. So we're kind of learning more about cancer and diet all the time. There's some interesting research with actually IV vitamin C and cancer that I have to explore more, but there's just a lot of stuff out there that we're learning more and more about every day. Complementary and alternative medicine. So IV vitamin C, that would be considered complementary and alternative medicine. Absolutely. Complementary and alternative medicine is just such a broad field. You can see here it includes biologically based approaches. These are diet, herbs, and vitamins. So the DASH diet would be considered complementary. It would be considered complementary to an antihypertensive med. If you take vitamin C, that's complementary. If you go get a massage, that's complementary. Homeopathy, Ayurveda, yoga. If anybody's ever done yoga, you've practiced complementary and alternative medicine. And complementary and alternative medicine has been used for thousands of years. It was our original medicine before Western medicine pharmaceuticals came in. And so many people feel comfortable with it. Many people find they get relief from it. Many people are curious about it. And I think it's a significant area of nutrition and health to learn more about for sure. Complementary and alternative medicine. So from a nutrition standpoint, you can look up what we know about different complementary and alternative medical nutritional kind of interventions. So you can look up anything that we know about vitamins and minerals. You can look up dietary supplements. You can look up botanicals. You can look up antioxidants. The best site to look them up is the National Institutes of Health Office of Dietary Supplements, and they have this alphabetized website where you can search any dietary supplement by its alphabetical name and find the most current information based on kind of meta-analysis on what we know. So that can be a really good place to look for information about complementary and alternative medicine. Like I said, many people feel comfortable with complementary and alternative medicine. However, like any medicine, it does have some risks, and it may work, it may not work, it may cause more harm than good. It may interact with some traditional medicines or Western medicines. And so it's always important that anytime you're using anything complementary or alternative, especially something that you're ingesting, you discuss it with your doctor. I think I've discussed this already. I'm all for trying different complementary and alternative therapies. I think there are so many out there, and you may just find one that really works for you. Supplement-wise, I'm really big into curcumin right now. As far as other complementary and alternative medicines, I've tried acupuncture, chiropractic, massage. Who's going to complain about that? Sauna is one of my big ones right now. But those are just a few. Okay, quiz. So, the immune cells of the body do not include, hopefully you said the antigens, because the antigens are actually what come into our body as foreign invaders. Which of the following produce antibodies? The B cell. I think of body as B cell. The leading cause of death in the United States is, this should be easy, heart disease. Plaques in the artery contribute to the development of, hopefully you said C, atherosclerosis. Which blood lipid correlates directly with heart disease? Well, they all correlate with heart disease, but high LDL will correlate with increased risk of heart disease. Moderate amounts of alcohol may protect against heart disease by, alcohol can actually reduce clot formation. So alcohol is a mild blood thinner. What is the most effective strategy for most people to lower their blood pressure? Remember that chart I showed you? It was weight loss. Weight loss is one of the most effective ways to lower blood pressure. Complications of diabetes may include all of the following except osteoporosis. The most important dietary strategy in diabetes is to provide for consistent carbohydrate intake. Which of the following can help protect against cancer? phytochemicals. So those are helpful compounds found in plants. All right, that's it. Thank you guys. Bye.